Are there challenges when you're working with outside partners in the sense that they might have their own agenda and influence on what they want the funding to go towards?
Well, this is a very important issue. So one firstly has to recognize and respect that people who come with funding have got their own interest, and that has to be respected. But secondly, you need to find a situation of collaboration where we collaborate, where we're not dictating to industry, where we're not dictating to outside funders, but we need to find a situation where we're actually working together in a collaborative way to address all of the elements that are required for health research. In fact, in our report, which we wrote now for the National Health Research Committee, we show that there are 7 elements that you've got to get right in this whole in health research. The first element clearly is the funding. There needs to be an appropriate quantum of funding to start off with, because if you've got no money, you might as well close shop and go home. So that's where you start. But the second issue is about people. Is about training health researchers of all types in the laboratories, in the clinics, at a population level, for health systems. And so you've got to train the right types of people. And then the third issue that we've identified as very important is actually building the places where these researchers work. You need laboratories, you need clinical research centers, and you need community-based facilities where research can take place. And then the fourth element that is key and that requires collaboration is the regulatory framework for research, both in terms of protecting the public. Ethics of research must be done properly, as well as in terms of registration of new medicines. Here, this is done by what's called the Medicines Control Council. You've got to make sure that is working well. And then the fifth element of this particular system is to make sure that what comes out of the research process can actually be taken up by the health system. Many of us publish papers as academics now, and we're just too happy that we've got a paper in the Lancet. And then we move on to the next paper without making sure that there's followed through. Our discovery is in fact translated into something useful for society. We need a mechanism to do that. And then the sixth element that is required by this system, that's called translation, what I'm talking about, taking things from the lab into the clinic. And then number six, you need to monitor what's happening. Right? Yeah, you need to monitor the funding flows, how they are being used, and the impact thereof. And then finally, you need a review, a process of constant review and feedback, a feedback loop that goes back to step one. Is the money enough? Are there enough people? Is there infrastructure? Are we regulating it properly? Are we monitoring it properly? Are we translating it properly? You know, so it's a dynamic. So a health system is a dynamic process of continual improvement and continual growth.
Is this partnership model and this model that you now have to review the entire system, is it sustainable then in this way?
This is the only way in which it becomes sustainable, right? Doing it any other way is unsustainable. In other words, doing it in a fragmented fashion, you then do not really have a system that works and that will produce the goods. And of course, as I said, we've got the mechanism of the National Health Research Committee, which looks at these aspects, at all these 7 functions of a health system, and gives feedback to the ministry, gives feedback to government, as well as interacts with all the stakeholders such as industry, such as external funders, to make sure that we've got a system that works. Because in essence, what we told the ministry when we started this work in 2011 was that all they need actually is a national health research system. That this is what South Africa needs. And a national health research system is what we're talking about. A well-funded program with people and infrastructure to do what needs to be done.